Welcome to Prescription for Primary Care. I'm Rebecca Ramdahal, your host for today's episode. Today we're talking to Dr. Brian Day, former president of the Canadian Medical Association and founder of the Candid Surgery Centre. Also with us today is Raymond Rupert, former primary care physician and CEO of Healtheon, and Josh Steinberg, vice president of development. Welcome, Dr. Day. Thank you for joining us.
You're welcome.
Dr. Day, so you spent decades advocating for healthcare reform in Canada. So what would you say, like right into the fire, what would you say is the most critical change that needs to happen to truly change or transform the system, even if it's controversial?
Well, I think the most critical change, just in a general sense, is putting patients first, not governments first and government bureaucracies first. We have, one of the most expensive health systems in the world and one of the worst performing health systems of all developed countries. So that's a bad combination. We're struggling with the reality of, advancing baby boomer age groups like myself. I mean, I've so far in over 75 years cost the health system $250. I don't think I'll make another 75 years and cost it just $250. Right. So that's one thing. The other thing is we are victims of just this applies to all health systems. We are victims of our own success in developed countries because these new technologies that are coming along, virtually none of them save money. They all cost money, and they all, we're going to be able to diagnose every little thing that exists, and yet we won't have the funds to treat them. So this is the future, and I think that what's underestimated, not talked about enough, is the economic impact of healthcare on the country. I mean, it is the single largest component of every provincial government right now, and that's not talked about very much. That we are indebting our future generations, our children, our grandchildren, to suffer as a result of our mismanagement of the health system.
So when you look at the economics, it really is not sustainable with the current single payer system. Is that right, Dr. Day?
Well, I think we're paying in our country to stop people getting treated. We are spending money to not treat patients.
That's a little ironic. Yeah. But there must be ways to shorten the wait lists. Don't we need more capacity?
Yes, people often joke about the fact that I knew Fidel Castro, and what was interesting, he solved wait lists in 1 year.
How?
He gathered together, an elderly gentleman wrote to him saying he was suffering in pain and had been waiting 9 months for a hip replacement.
Yeah.
So Castro called together the head of every hospital region in Cuba.
Yeah.
He said, we will meet here 12 months from now. If there are wait lists in Cuba for patients needing healthcare, there will be serious consequences for each of you. Guess what? A year later, there were no wait lists.
Oh, okay. So
yeah. Unfortunately, there are big disadvantages to having a dictator, but in certain areas that you could argue that they're effective.
Yeah.
To me, the biggest two things the government could do to shorten wait lists would be one, to eliminate global block funding for hospitals, whereby every patient who goes to the hospital gets its money up front every 12 months, and every patient who goes there is a cost to that hospital administration. The chief financial officer, the last thing they want are patients. The second thing that you can do, which other countries have done, is a healthcare guarantee, whereby if you are not treated in what physicians and health providers believe is the most appropriate time, if you exceed that time, the government is legally required to pay for you to go and have that treatment done anywhere else that it's available immediately, even if that means going to the United States or out of the country. So those two things don't involve the private sector at all.
Yeah.
But the trouble is because we've neglected the health system to such a great degree in Canada. We've built up a massive debt, if you like. We've built up this massive patients waiting, and there will be an initial cost to doing those things. Yeah. But long term, it will actually save money. We know that prevention of healthcare is every doctor believes in it, but to me, not treating patients, preventing people from getting treated early, unless the patients die on the wait list, is actually going to cost more in the long run, because those patients develop more complex problems as they wait for healthcare. And you know, it's cynical to say it, but in Canada, we have about 35,000 patients die every year on public wait lists without any legal means to get off them in their own province. That's a saving. That saves the government a lot of money.
Well, do you think we should have sort of insurance that people can buy that allows them to go to other countries for care?
I think the government should have a healthcare guarantee.
Yeah.
I think that there should be, you know, I believe obviously that Canada is the only country on the planet, literally on the planet. You know, I used to say North Korea, Cuba, but that was based on a manufactured statement by a BC ophthalmologist. But in fact, there is no country on the planet where private health insurance and private healthcare is unlawful. And so we are the only country with a state monopoly. And
what seems to be happening, Dr. Day, is that some people that are sort of more astute or aware are buying U.S. health insurance but live in Canada.
Yes, but you know, here's the thing. I think universality is a great concept.
Sure.
Except that we don't have it in, say, prescription drugs. We don't have it in ambulance access. We don't have it in dentistry. We don't have it in physiotherapy. But private insurance, and most Canadians have private insurance that covers that. And in most cases, it's an employer subsidized benefit. So I think that what we do in Canada, what we should do in Canada, is allow private health insurance, and for those that are in the lower socioeconomic groups and can't afford it, rather than the state can simply pay their premiums. That's what happens in Switzerland. I lived in Switzerland for 4 months, and in Switzerland, the low income groups are subsidized or completely funded to have the same insurance as wealthy people. And actually it works out well. So the fact is that you know, Conrad Black does not need free health insurance. So that's the flaw with universality. It takes away from. I mean, to give you an example, my daughter was at university in Victoria, and I used to get free ferry rides to go, and my wife, to go and see her because we're over 65. Well, a young struggling couple in Vancouver with 3 kids and both working hard are paying for me to have free ferry rides. That's the flaw with universality.
Yeah. Okay. Well, it's a great value, but I guess it doesn't work.
Yeah. Hey, so, you know, we're talking about, you know, sort of the hospital, the more complex cases, of course, but if we drill it back down to primary care and we look at, you know, the 6.5 million Canadians that don't have access to primary care, and, you know, there's fewer and fewer physicians going into family medicine, you know, from med school and whatnot into residency. Where do you see, you know, the government stepping in on that front to say, hey, we need to support our family doctors. We need more people going into family medicine, because the patients who don't have access are going to the emergency departments, or they're going to, you know, walk-in clinics and spending the day there and losing out on their income. So I think there's, you know, universality makes sense from that perspective. Where do you see that fitting in?
Well, I mean, as a disclaimer, my wife is a family physician. My sister-in-law and brother-in-law are family physicians, and I have nieces and nephews who are family physicians. Unfortunately, of my 6 kids, none of them, you know, none of them went into medicine, because they were seeing the struggle. But obviously, you know, especially in Canada, it's a clever government strategy to prevent the next step, because you need to see a family physician to do the actual screening, to give you a diagnosis that the family physician will send you on to a specialist if necessary. So you know, one of the quotes, I've written it down because I don't want to be misquoted on this, but this was what the BC Appeal Court said in our case in dismissing us. They said, wait times in considerable measure flow from government rationing of healthcare. The system is intentionally under-designed in order to achieve fiscal sustainability. That waiting, this is the BC Appeal Court rejecting our arguments, that waiting inherently carries the risk of death. So this is
Wow.
this is what the government is proud of winning, based on those arguments and based on those conclusions. So we have to accept that this is government policy. And as you alluded to, the shortage of doctors in Canada is not it's not a kind of a mistake. It's government strategy. And you know, when I arrived in Canada in the 70s, we were between second and fourth in the world in doctors per population. Today we rank 69th. This is government strategy. Not only are we unusual in having only government-run hospitals. I mean, you know, as an aside, the most hospitals in communist China are private. And we are the only country that has only government-run hospitals, but also we're very unusual in having only government-operated medical schools. So we don't allow the private sector, even the non-profit private sector, to develop medical schools. The United States has 57 non-government private medical schools. And when you think of them, like Harvard, Yale, Columbia, Stanford, these are not exactly second-rate medical schools. So there is, if free enterprise, and I'm not talking about free enterprise necessarily for profit, those private universities, medical schools are private but non-profit, but they're not operated by the state. And I think that Canada, you know, extrapolating, we should have 5 or 6 private non-government medical schools. And because that's not what the government wants, because if you have more doctors and nurses, you'll treat more patients. And as the BC Appeal Court said, the government doesn't want, it intentionally wants to ration healthcare. And this is something that Canadians want to know. I tell you, very few individuals that I meet who haven't been involved in healthcare are aware that we're the only country on the planet where it's illegal to access private health insurance and private healthcare in your own province.
If the public becomes aware of this, or is there going to be kind of a tipping point that the public won't really tolerate this any longer someday?
I think so. I think the baby boomers, you know, as they get old, baby boomers, they are very intolerant of government control, and I think they will put pressure on. But what's interesting is the biggest and strongest contingency of those opposing state control of their bodies, which is what it is, are actually young adults. And they're the same people who are driving who are rebelling against the fact that I am being subsidized by them when I don't need to be subsidized by them. And you know, as I think we all know, that young productive people are not going to stay in this country if things don't change. This is not quite aside from healthcare, because we are mortgaging them with our massive debt.
So, one of the elements that's really the foundation of healthcare is primary care.
Yes.
So we've spent a couple of years trying to think of a model that would sort of increase capacity in primary care.
Well, I think that we have to put patients first, and that's where I started off. If you put patients first, I mean, I think it's terrible that patients don't have a family doctor and can't get a family doctor, but the cause is government. There's a massive inadequate amount of funding going into family doctors and specialists. The fee that the commonest operation in orthopedics is arthroscopic surgery, which is my specialty.
Yeah.
The fee today is the fee for that surgery today to the surgeon is $325 in BC. In 1981, the fee was $310 in 1981. And this is why no young physicians graduating today can afford to buy a house. So there is a big economic problem. And as I say, the government, and this is not me, I say, as the BC Appeal Court says, the government is intentionally rationing healthcare by not paying doctors, by not paying nurses, by not employing nurses, and we are driving nurses out of the country. So the nurses are leaving the country as thousands of Ontario nurses commute down to the States to work. And we need to, I mean, there is an economic factor that is at play in limiting doctors' choices in going into family practice and in limiting nurses from working. We ration nurses and specialists by closing operating rooms and by,
So, Dr. Day, just going back to what you were talking about, like the doctor's fees, coming from someone who, I don't have a healthcare background, so the public perception is that the doctors make so much money, and that's why, and that's why I know of so many people who have this idea, oh, like I don't want to have, why do I have to pay for the doctors? They're already rich enough. It's like they have this, I guess it's a very old fashioned idea that doctors make a lot of money now, when they don't. So we got to find something. First of all, we have to change the public perception that, you guys are struggling just as much as the rest of us. And also we got to find a way to give doctors more money.
Well, I think that honestly, this is not rocket science. I think make the wealthy pay more than the less wealthy. That's the way it should be, and that's the way it is in Switzerland. That it's run on private health insurance, and it's somewhat similar in Holland. That if you're wealthy, you pay higher premiums. And the low income groups pay nothing or else medical premiums, and that generates revenue. But there is, I mean, I've been unable, after thinking for decades, to think of any monopoly that serves the consumer well, and that's what we have in healthcare in Canada. And of course, the hypocrisy is awful, and it needs to be exposed that when our political leaders need healthcare, they head off to the United States, and the state pays for it. One of the paradoxes that I felt was awful. Our federal employees such as judges and federal members of parliament are exempt from all of these restrictions on private healthcare. I personally had judges in our clinic being paid for by the federal government, saying the judges that sit on the appeal court saying we're not going to allow this for Canadians have that privilege themselves. Monique Béjean and Pierre Trudeau are both credited with introducing the Canada Health Act. Both of them were treated privately by one of my colleagues after they brought in the Canada Health Act. This is the paradox and the hypocrisy that undermines Canada's health system. So I think that allowing private health insurance with the stipulation that with the provision that low-income groups are subsidized if they want it, that's what happens in pharmacare, so-called, or it's what happens with our extended health benefits. That I don't support public, a new generation of public pharmacare that's being created. I think instead the government should be paying the premiums for those that don't have extended health insurance, because the last thing we all want is to be waiting 6-9 months to see a pharmacist to get our drugs, which is what will happen if the state takes it over. And I think that we've got this massive bureaucracy. If you just take a practical example, all you need to do is go and talk to people from Germany or Holland or Switzerland, and these are highly rated health systems. That's it all comes down to this monopoly, and I think allowing some private competition will improve the public system. That we won't, we don't, as I would like to see, I'm not a Trump fan, don't get me wrong, but I do support this idea of a Department of Government Efficiency. I mean, right now we have, I think we must have it. It's not publicly announced, but we must have a Department of Government Inefficiency in Canada that's responsible for this.
Yeah,
I think if I understand you correctly, it's really, when we look down at primary care, it's about giving patients a little bit of choice of, how they receive care, how they seek out care to give them the best possible outcome for their health venture.
Yes, and I think family physicians have to be, they have to be rewarded for the work. I think that there should be a room for some element of competition, and that the other byproduct of our system is, in my specialty, and we know this is the best and the worst doctors are paid the same. There's no such thing as, quotes, a market where the better doctors are rewarded, because everyone's at maximum anyway, and the worst doctors get paid the same as the poor doctors. Whereas if you go to other countries, good doctors get paid more than bad doctors because they get more patients. But of course, when you've got a shortage of doctors, then that doesn't apply.
Okay, well, thank you, Dr. Day. We're actually coming up to the half-hour mark. There's a lot of information to unpack there, but we do really want to thank you so much for joining us. We really appreciate your time. So thank you, Dr. Day, and everyone for joining us for this discussion. To our listeners, thank you for tuning in to Prescription for Primary Care. Don't forget to like, share, or subscribe to our podcast. Until next time, we wish you good health and better health care. Thank you again.
Thank you.
Thanks.